As a result of dramatic improvements in diagnosis and treatment of congenital heart disease, many children born with heart defects are now growing up and thriving. With better survival, we have learned that children with congenital heart disease, especially those who need heart surgery during the first year of life, are at higher risk for developmental delays and learning concerns. Identifying, treating, and preventing developmental delays early is the best opportunity we have to improve outcomes. The goal of this video is to help you better understand your baby's developmental needs and what you can do to help your little heart victor meet their developmental milestones.
We had never heard of congenital heart disorders before. We had no idea what it meant, what her future meant. I mean, it was just really hard because we spent so long being excited, and so it was hard to imagine that, things were going to be different than we expected. I think that we first heard about the developmental delays in our first or second echo meeting when we met with the cardiologist.
To help promote your baby's development, our therapists would like to share important information about what you can do and how we can help. From the first days of life, children begin using their bodies to learn about the world around them. In infancy, delays in motor skills are most common, involving the control and movement of the head, trunk, arms, and legs. In the first weeks of life, you can help your baby bring their hands together to help them learn to explore and self-soothe, which is important for later feeding and reaching. To help them learn about their hands and feet, you can play games with your baby's hands and with their feet too. Offer toys overhead to encourage reaching up and away from the body. You can help your baby roll from side to side and use toys or your face to encourage your baby to follow with their eyes. Besides back and side positions, one of the most important positions to your infant's development is tummy time. Tummy time helps to increase neck strength and head control. It's important to remember that tummy time is for babies who are awake and being watched. Remember, back to sleep, tummy to play. Some babies may not like tummy time at first. Practice tummy time for short times at first and increase the time. After diaper changes, when your baby is not likely to fall asleep, may be a good time. Every bit of tummy time makes a difference, and there are different ways to do it. You can start by placing your baby on your chest while you are sitting and leaning back or lying down. Encourage your baby to lift their head and look at your face by talking to them. Or lay your baby across your lap on his or her tummy. Maybe pat his or her bottom. Or put your baby on their tummy on a flat surface and place toys or a mirror in front of them. Your baby will gain strength by practicing lifting and controlling his or her head. Sometimes placing a rolled blanket under your baby's chest will make it easier for them and allow them to focus on lifting their head up. Offer your voice or other sounds above or behind the baby to encourage looking up. Your baby also likes to be held in a sitting position and see what is going on. Make eye contact and talk to your baby. As your baby is able to hold their head up, you can provide support at your baby's shoulders and slowly lower your baby to strengthen back and tummy muscles. Or place baby's hands near their feet, called propping, to help them sit and balance. Talk or place toys in front and above them to encourage head lifting. When your baby is sitting on your lap, you can put your baby's feet on a surface while supporting his or her body. We want your baby to begin putting weight on his or her legs. The staff can help you practice positioning with your baby during your hospital stay. It's important to continue play and positioning to support your baby's development at home. In every state, infants and children from birth to 3 years old with developmental delays or specific health conditions can get early intervention help in your home. Early intervention is a program of services that can help infants and toddlers with disabilities or delays to learn many key skills and catch up in their development. At discharge, our social worker will provide a referral to the early intervention program in your area.
Physical therapy was the route that we needed to take with his developmental delays to give us the tools to get him to where he needed to be. We also had early on come to the house. It's a great program that we had a physical therapist coming at first, and we also had an occupational therapist. Aside from the physical therapy parts, we worked on his eating and his feeding with the bottle after the feeding tube was removed, and now we're working on speech.
Besides receiving early intervention services at home, the American Heart Association has also recommended that children who have heart surgery have formal evaluation or testing by a developmental specialist or psychologist starting in infancy. At discharge, we will schedule you and your baby for a developmental evaluation in the Congenital Heart-Centered Neurodevelopmental Follow-Up Clinic at some time between 6 and 12 months of age.
The 9-month neurodevelopmental follow-up is really important to go to. They go through all areas, not only the physical development, but speech and cognitive, and it was important for us to know where he was at with all of those.
At this clinic, they will do play activities with your child to look at his or her problem solving, language, and physical movements. This gives us information which will be shared with you about your child's developmental strengths and weaknesses.
Giving him the tools now helped him to catch up faster and be where he should be developmentally. He is no longer delayed in his gross motor skills, his walking. He's climbing up stairs. He's trying to run. Compared to another baby who hadn't had surgery or had health issues or heart issues, he's right where he should be. He really is my little heart warrior. We've worked hard to give him all the tools possible that we could find, and thought that was important to at least give to him to help him on his adventure.
Thank you for watching. We hope this video helped you better understand your baby's developmental needs and what you can do to help promote development in your little heart Victor.